Hello, I'm Dr. Alex Ray Grant, staff neurologist at the Cleveland Clinic at the Mellon Center for Multiple Sclerosis. I'm here talking with one of my patients about topics in multiple sclerosis. And my patient was kind enough to let us share this conversation with you. Do you have any questions for me?
I actually do. How do you go about diagnosing MS?
So the diagnosis of MS is not based on any one feature. It's a combination of the history, the examination, and things like the MRI scan. There's no one test that makes the diagnosis, and in fact there's no test that rules that out, so sometimes it's pretty complicated. You know, the typical story of MS is one of people having relapses. These are events that last for days or weeks, where they have new neurological symptoms. For example, losing vision in one eye for a few days or weeks, getting numb from the waist down for a few weeks, getting double vision. Something like that is a pretty characteristic story for multiple sclerosis. In some cases it's not like that. In some cases it's a gradual progression over months to years. For example, somebody may have trouble with one leg dragging and gradually gets more trouble with that. The exam that we do neurologically helps us to see signs of problems with the nervous system. So we can see reflex changes, we can see vision changes, we can look in the eye and see changes in the optic nerve. All these things help us to define the diagnosis as multiple sclerosis.
So you mentioned that an MRI. What does the MRI show, and how would you use that to diagnose someone?
So the MRI has become really important to diagnose MS. It's part of our criteria to make the diagnosis that we put together with the story. And the MRI shows deep in the brain areas where the lining of the nerves has been stripped off. We call that myelin. And just like in your house, there's wires in your house and they have insulation around them. Well, the myelin is the insulation of the brain. And so these are spots deep in the brain where the insulation is stripped off. And so there's a characteristic look to that we look for in the brains of patients with MS. Now, sometimes people can have little white spots and it's not multiple sclerosis. And there's things like diabetes, blood pressure, cholesterol, smoking, which may cause that. So that can be a little complicated for us. And then we look for things lighting up with the dye, with the gadolinium, with the MRI. And these are all helpful in making the diagnosis of MS. Sometimes we'll look at the spinal cord too, because sometimes changes can occur in the spinal cord that are also helpful with the diagnosis.
Okay. So when you make a diagnosis, how certain are you that that is the accurate diagnosis of having MS?
Yeah, so I mean there's times when it's really simple. There's times when the story is very characteristic, when the MRI is characteristic and it's a bit of a slam dunk. There's other times when it's very hard. So sometimes, for example, we will do spinal fluid testing, and that helps to see if the immune system is active in and around the brain and spine. But we don't always go to that. We don't like to go to that unless we have to. There's other times when we have to follow the MRI and the story and the patient over a number of months or years before we make a diagnosis. So sometimes it can be quite difficult. Thanks for your attention. We appreciate your joining us for this program. If you have any more questions you need answered, please check our website, which you'll see below.